Hi, Mark at Physical. Now 8 weeks post-surgery of rotator cuff repair. Those of you who've seen the last videos, I tried to give you some hints of what was working for me after being 2 weeks post-op. Now I'm 8 weeks post-op. Before I do, I want to send a special thank you to my daughter Sabrina, who has helped me throughout this, calling me, coming over, getting things for me, making sure I'm doing the right stuff. So thank you, Sabrina. I've got 2 other tips for you of how we do things in the clinic and what has worked for me, starting to work on getting my range of motion back. The first thing that I want to show you is how we do the pulleys. So pulleys are going to be for active assist range of motion, and if you can relax enough, you can also even make them passive, meaning you're not going to put much force into this when you start elevating your arm. But how we have seen a lot of people do it is, and I'm going to show you on my left arm, but they will come in and they'll try raising their arm through a straight arm, which I have found puts a lot more stress on your shoulder and in general is just harder to do. What I like to do and what has worked best for me, keeping the elbow bent, bring your hand right to your right shoulder, because this is my right surgical side. Using your left arm then just to slowly work on bringing this up. But it's a whole lot more comfortable if you keep that elbow bent, keep it close to you, and keep your elbow pointed in what is called the scapular plane, which just means if you pointed it straight, come out about 30 degrees to the side and do it in that plane, slowly working it up. That is much more comfortable. This works real well, it feels a lot better, and to me, it doesn't hurt like doing it with a straight arm. The second tip I've got for you is a lot of people see online or are told to do fingertip walking. I have tried that, and by that I mean I'll show you with my left arm, but putting your fingertips against the wall and trying to walk it up. I have found that that, at least for me, puts a lot more stress on my shoulder, hurts more, and I'm not as successful. So in our clinic, we don't have them do that. We give them a soft ball like this. We'll put that ball against the wall, and this one I will show you with my right arm, but we put that ball against the wall, gently press into it, and just slowly work it coming up the wall, nice and easy like this. Again, keeping a bent elbow, keeping it close, but this feels a whole lot better to me. There's less discomfort with it, and I'm able to get higher when I do this. So 2 little points that I have found, again, now knowing what it feels like to have this kind of surgery, so I want to pass that on to you. If you have any further questions, contact us at physicalaverrazil.com.